If you're struggling with bipolar depression,
Here's me, and here's my depression.
Depression is a serious medical condition that takes so much out of you.
Talk to your doctor to see if the option of adding Abilify is right for you, and be sure
Before I started taking Abilify,
to address a possible life-threatening condition.
Every day, more and more psychiatric drugs are being given to children and teenagers as a way to address various mental and emotional health issues. This is expected to continue to increase. What's also increasing is mental health issues, mental illness, and learning and cognitive problems in children and teens. Doctors continue to diagnose more and more young people with disorders such as ADHD, ADD, depression, anxiety, bipolar disorder, autism, and the list goes on. If drugs are the answer, then why do we continue to see more of these problems? Natural holistic therapies like nutrition, herbs, acupuncture, mind-body techniques, and others are all safe alternative options to medication, and studies show them to be more effective or as effective as drug therapy, without the side effects, ill effects, or dependencies. While in some cases medication may be helpful, other techniques should be considered first, rather than prescribing medicine prematurely.
Pharmaceutical industry pushes it on people too fast and doesn't see other outlets, and once they've started, they don't accept the idea of not doing it. And so I have lots of people in my life who have been on medication their entire lives, and when they stopped, there was a lot of pushback from their doctors, and because that's since they were 10, that's all they've known is taking meds every day.
And all these, even there's 1 in 10 people in the United States is on a medication for the whole of their life. And the rest of the world isn't like that.
I was on medication for insomnia, and it was working for a little while, and then I started getting nightmares from it and couldn't sleep, and so I stopped taking that.
I'm on 3 different medications. I've been on 2 for as long as I can remember, and then 1 I got during elementary school.
I had every side effect, so I wouldn't sleep.
So a lot of medication is just a mask to help you cope or function in life. One of the things that people will say when they are taking these medications is that they no longer feel themselves, they're cut off.
So it actually made the problem much worse than it was before.
Getting off it, I almost feel like I have less anxiety.
It just was not working, and I was feeling more depressed.
Medication never really helps me.
I wouldn't eat, and I was losing a lot of weight.
When we are quick to medicate, my concern is that it's really about helping someone manage the environment without ever feeling better. And we make depression and anxiety a noun, a thing. Then we're saying, let's keep this person stuck.
People going on meds need to be monitored closely, and they need to be checked in with.
And America, I've traveled all over the world, is one of the only countries that overdrugs their kids and their teenagers.
They start at age 6, and they try to drug you on things when all 6-year-olds are not on task, and what is there even to focus on when you're a kindergartner? And so I mean, when kids need it, they need it, and I respect that. I just think that they push it down parents' throats.
And they will switch in and out with not even paying attention to the side effects of oh yeah, Dola was on this med, that side effect really kicked her ass. We're just gonna put on this other med that has the same side effect that might also kick her ass.
Spending on psychiatric drugs has risen from about $600 million a year in 1985 to more than $40 billion a year today, while disability rates due to depression and bipolar illness have skyrocketed. Not exactly what you would expect to find if these drugs were actually working as advertised.
It's a business, and the business of healing is different than the business of medication.
Although there are many other options for treating mental disorders, many people think of pills as the only option. Medication may work for some people as a temporary remedy, but for many shouldn't be taken for an extended period of time. For small amounts of time, psychiatric drugs can improve the health of some patients or have temporary life quality enhancements. But the teenager may then become reliant on pills and think of them as something necessary for them to function for the rest of their lives.
I've been happier since I've started being on meds, so I think that probably has some correlation.
I mean, I'd say my mental state is better, but physically I just feel kind of worse than I did before.
They did help me like focus.
They give me motivation to kind of like improve my life.
It appears that these drugs may work for some people, but there is controversy here still. There are studies showing that benefits from these medications are due to placebo. Also, the brain chemistry imbalance and low serotonin theory is simply not a scientifically accepted fact anymore. In 1983, the National Institutes of Mental Health investigated whether or not depressed individuals had low serotonin. At that time, they concluded there was no evidence that there is anything wrong in the serotonergic system of depressed patients, but still proves to make billions and billions of dollars a year nationwide.
And if it can help you through a bad spell and then you can come out the other end and work on some things from a real healing perspective, that's great. But that's not really what happens. Most people who go on psychiatric drugs for depression and anxiety pretty much stay on them. I mean, it becomes a way of life. And when your brain hasn't even fully formed, you start these when you're 12 years old, 13, younger. You know, are you really the person you would have been if you weren't taking these chemicals while your brain was developing?
First of all, a factor that cannot be overlooked is your diet. Foods have an immense impact on your mood and ability to cope and be happy, and eating the right foods will best support your mental health.
Nutrition is real, and like if you're not eating properly and if you're not fueling your body properly, then that has a direct correlation with your mental health.
Kids aren't making the right components to be healthy. They're not getting the right nutrients. Fat-soluble vitamins, for one. B vitamins. We're looking at a lot of gluten. We're looking at a lot of grains. We're looking at a USDA and a food pyramid that's promoting genetically modified foods. All of these have significant bad effects on brain chemistry.
We're medicated. We eat the worst food on the planet. It's not even food anymore. They take natural food, they do a bunch of stuff to it, and then come up with something else that looks, tastes, and smells even better than food, and then you eat that. It's not real.
We spend more on medical costs than any other westernized countries, and we have the worst outcomes. It's not on healthcare, it's on sick care. You know, I understand you're saying what that costs more because my insurance will cover this medicine, but it won't cover this fish oil pill.
Science is showing us that we have an emotional biochemistry. We can make chemicals that help us feel good, prevent depression, and even help us plan and complete tasks. But in order to do this, we have to fuel our bodies and brains with the right foods and nutrients. So what other options are there? Homeopathy is a very effective alternative holistic medicine, and acupuncture and bodywork are ancient therapies that have been modernized to treat many conditions successfully.
The philosophy in Western medicine is that we're broken, we need a pill to fix us. And holistic medicine is we're complete and intact as we are. Sometimes we forget or get off course. Even in school situation, they don't tell the teachers they're doing homeopathy because they're getting pressured to do medication from the school.
The most important tool in addressing any mental health issue or diagnosis is your creativity and courage to seek and find genuine care, ask questions, and take charge of your health. There are at least 5 important strategies to consider if you are facing depression or other mental health issues. These strategies have nothing but positive effects and are generally very inexpensive to implement. Do a bit of emotional housekeeping. Improve your nutrition, get regular exercise, supplement your diet with omega-3 fatty acids, get outdoors and get sunshine. Always remember that these 3 primary factors, exercise, addressing emotional stress, and eating right, will make you feel healthy and whole. Whether you want to overcome depression or a mental health condition, feel happier, or just want to stay healthy, these are the lifestyle changes that will get you there or help you on the way. So please actively investigate and use the natural treatments above, ideally with the support and guidance of a knowledgeable natural health care practitioner.
We don't just accept the status quo, all right, what's normal, and that we continue to educate each other, and that we continue to challenge. You don't have to protest your doctor, but you can educate and ask questions and let them tell you what they need to tell you, and just share information. Because ultimately, it's up to you guys. This is your world.
Trying to make ends meet, you're